What happens when a dangerous mix of medications pushes the brain into chaos? In today's episode, we unravel a chilling case of a calculated overdose that spiraled into a fight for survival. Welcome back to Medical Toxicology. Today's story is nothing short of dramatic. A 40-year-old man, an overdose of duloxetine and lacosamide, and a bizarre blue residue that puzzled even seasoned doctors. Let's dive in. Lacosamide, also known by its brand name Vimpat, is a commonly prescribed medication for controlling partial-onset seizures. While it is highly effective when used as directed, exceeding the recommended dose can lead to toxic and potentially life-threatening effects. In this video, we will explore the toxic dose of lacosamide, who is most at risk, and why this medication must be handled with care. Toxic dose thresholds. The toxic dose of lacosamide depends largely on an individual's body weight. For individuals weighing less than 50 kilograms, approximately 110 pounds, toxicity can occur with doses exceeding 0.5 milligrams per kilogram of body weight. For individuals weighing 50 kilograms, 110 pounds or more, toxicity generally occurs when doses exceed 800 milligrams. How does toxicity happen? Lacosamide works by modulating sodium channels in the brain to stabilize hyperactive neurons, reducing seizure activity. At therapeutic levels, it is both effective and safe. However, when taken in excessive amounts, it overwhelms the brain and nervous system, leading to dangerous symptoms such as seizures. Paradoxically, an overdose can cause seizures, the very condition the medication is meant to treat. Severe drowsiness or unresponsiveness. Toxic doses depress the central nervous system, leading to difficulty breathing and inability to maintain an open airway. Heart problems. In some cases, an overdose may result in irregular heart rhythms, though this is less common. What happens in a lacosamide overdose? When someone takes more than the toxic dose of lacosamide, the effects can appear quickly, often within hours. Symptoms can range from mild, such as nausea or dizziness, to severe, such as loss of consciousness or uncontrollable seizures. In extreme cases, these effects can be fatal without immediate medical intervention. Duloxetine, a medication primarily used to treat depression, anxiety, and certain types of chronic pain, can pose risks when taken in excessive doses. In adults, consuming doses exceeding 120 milligrams daily but less than 1,000 milligrams typically results in mild to moderate symptoms such as nausea, dizziness, increased heart rate, and agitation. However, when taken in significantly higher amounts, duloxetine can lead to severe complications, including liver toxicity, serotonin syndrome, and even life-threatening conditions. In children, toxicity may occur at doses greater than 7.4 milligrams per kilogram of body weight, making it especially important to ensure safe storage and careful dosing in households with young ones. It all began with a 911 call. Paramedics found a man barely breathing, lethargic and disoriented. Beside him, a half-empty blister pack of duloxetine and a prescription bottle of lacosamide, but the most bizarre clue, bluish residue found in his stomach. As the medical team worked to stabilize him, the mystery deepened. Within moments of arriving at the ER, he suffered a sudden seizure. Doctors rushed to intubate him, administer anti-seizure medication, and begin life-saving measures. But this was just the beginning of their battle. Duloxetine, often used for depression, can trigger serotonin syndrome in high doses. Lacosamide, a seizure medication, ironically becomes the villain when taken in excess, disrupting the brain's electrical balance and causing seizures. Toxicologists were brought in to assess the damage. Blood tests revealed signs of liver stress, while EEG scans confirmed ongoing seizure activity. Time was running out to manage the chaos caused by this dangerous cocktail. Doctors turned to activated charcoal to prevent further absorption of the toxins. Meanwhile, they faced another complication. His history of chronic benzodiazepine use raised the risk of withdrawal, further complicating his already precarious condition. Over the next 24 hours, his condition remained critical. Every attempt to reduce sedation was met with agitation and recurring seizures. The medical team was walking a tightrope, balancing sedation, seizure control, and his compromised liver function. On day 3, there was a glimmer of hope. He began following basic commands, signaling progress. With careful adjustments to his treatment plan, his liver function improved, and his seizures came under control. By day 4, he was extubated and transferred to the medical unit for monitoring. The blue stomach mystery was solved. A dye capsule used to conceal the overdose had ruptured, leaving its eerie residue behind. This case highlights 3 critical lessons. 1. Mixing central nervous system active drugs can lead to life-threatening complications. 2. Rapid intervention, including seizure control and decontamination, can be life-saving. And 3. Chronic medication use can complicate treatment and recovery, requiring specialized care. Stories like these remind us just how fragile the balance is in our bodies. If you or someone you know is struggling with mental health or medication misuse, seek help. And as always, stay curious and stay safe. What do you think about this case? Let us know in the comments below. And if you found this video educational, don't forget to like, subscribe, and hit the notification bell for more real-life medical mysteries.